it is true that you'll be sore after the surgery. This is one of those surgeries that really does not require a large amount of narcotics. Now, I will send you home with a few small pills of narcotics, but I really urge you to avoid narcotics as they really cause constipation. The primary way to control your pain is with ibuprofen and Tylenol, and I promise that those medications will do really well for you. Before your surgery, I'm going to ask you to go to a sports store and buy some really nice tight-fitting underwear that will provide really good compression after the surgery. Along with that, I'll also ask you to use ice pretty liberally on and off your scrotum area, and that can really help avoid swelling as well. This surgery and the incision is very low maintenance. I simply use absorbable suture, so you do not need to come back in to get these removed. I simply ask that you keep the surgical area nice, dry, and clean. It is okay to take showers 48 hours after surgery, but I do ask that you do not soak in any body of water for about 4 weeks after your surgery. The easy answer to this question is as soon as you can. Now, generally speaking, most men start pulling the pump down into the scrotum probably at about the 3-week mark, and that's what I would aim for you as well. In general, the best way to do this is when you're in the shower, just kind of work on tugging the pump down as best as you can. Now, as I told you in a former video, I really do want you to avoid any narcotics after the surgery. That's the primary reason that men develop constipation, and the best way to do so is to avoid those narcotic medications. With that said, you could also take some Miralax or over-the-counter laxatives to help with your bowel movements. You know, I tell guys, just let your body guide you. I don't have any strict restrictions on lifting or movements. But generally speaking, you do want to take it easy over the first couple of weeks of surgery. You're not going to hurt anything if you do some lifting, but try to avoid any kind of heavy lifting. As far as bathing goes, it is okay for you to shower in 48 hours after surgery. It is not okay for you to be bathing into any body of water, whether it's a hot tub, sauna, lake, pool, any of those things for 4 weeks after surgery. If you're no longer using narcotics for pain control, you are okay to drive. As far as returning to work goes, it really depends on what kind of work you do. Most of my patients are okay returning to work about 7 to 10 days after surgery. With that said, if you're a construction worker who's doing a lot of heavy lifting, you probably want to take a couple of weeks off before returning to work. I ask all my implant patients to call whenever they have a question or concern. In general, things to look out for: if you're spiking a fever, if you've got new discharge or drainage from the incision site, or new redness or swelling in the scrotum, I want you to call my office right away. Now, we will have made all of your post-operative appointments before your surgery. If you have a catheter and a drain after the surgery, I will have made an appointment for you to come see me or one of my associates the day after your surgery. After this, you'll meet one of my staff members at 3 weeks after surgery, and then have an appointment with me at 6 weeks after surgery. I know that you're very eager to use the penile implant. You may have recovered pretty quickly after surgery, but I want you to know that it does take a little bit of time for you to heal from the inside. That time for me and for most surgeons is about 4 to 6 weeks, so we will have talked about this before surgery. And I do not want you to use the device for sex for about 6 weeks after surgery. Now, I've provided you the packet that has all the important information that you need before and after surgery. In that packet, you'll have a number to call for any questions or concerns. During business hours, you can call our office and somebody will reach out to you from my team. If it's after hours and if you've got an urgent situation or an urgent question, you'll be able to reach an on-call urologist who will be able to answer any of your questions.